Now we're going to be diving into health topics like we always normally do. And today we're shining a spotlight on a condition that affects millions of women around the world, but is often misunderstood. Polycystic Ovarian Syndrome, commonly known as PCOS. Now, PCOS is a hormonal disorder that can cause irregular periods, infertility, weight gain, and a range of other symptoms that deeply impact a woman's physical and emotional well-being.
Despite its prevalence, many women struggle for years without a proper diagnosis, making awareness and understanding very crucial. So joining us today are two experts who are here to shed light on PCOS and how it can be managed. First, we have Dr. Itunu Johnson-Sogbetun. She's a family physician in women's health, and she joins us live. Well, doctor, thank you so much for joining us. We also have live in the studio with us Olagoke Sarah. She's a passionate PCOS advocate who has been living with the condition and is dedicated to raising awareness. Ladies, thank you so much for joining us.
Thank you very much for joining us, Sarah, and thank you very much, Doctor.
Thank you for coming on. But Dr. Itunu, let's start with the basics, shall we? Can you explain what PCOS is and why it's just misunderstood or oftentimes misdiagnosed?
So thank you so much for having me. PCOS, as we have said, is Polycystic Ovarian Syndrome. And actually, the name is in itself confusing. It's almost a misnomer because polycystic ovaries is only one of the criteria for the diagnosis. Actually, it's a whole body hormonal disorder, and it affects the reproductive organs, and that's why some of the symptoms are irregular periods, and it can cause problems with infertility, though not always. But it also affects things like increasing insulin resistance, which can increase risk of diabetes, heart disease, and other health problems. It can also affect mental health. So actually, it's a whole body condition, and this is why it can be very confusing for people because they think because it's got ovary in the name, it's only a reproductive condition.
And doctor, when one hears this, then because you're saying this is, sometimes we miss the symptoms. What are some symptoms that when someone has to consider before going to get tested? What are some of those most common symptoms that women with PCOS experience?
So irregular periods is probably the most common one that women will first notice, or if they're trying to conceive and they haven't been able to. So also excessive hair production in areas that women don't normally have hair in, or really bad acne. But as I mentioned, other things like diabetes, pre-diabetes, struggle with weight, so increase in weight, can also be signs. Now, as I've mentioned, it's really important to know that there are 3 different criteria that we use for diagnosis, and only one of them is that polycystic ovarian syndrome. The excessive production of male hormones, or what we call androgens, results in either blood tests that show those excessive male hormones or symptoms of acne or excessive hair production. But also the irregular periods can happen with women having months with no periods or noticing an irregular pattern. So women may have 3, 4, 5, 6 months with no periods. But this is really important because a woman should have a period at least once every 3 months because of the risk to the womb lining, because PCOS can also increase risk of womb cancer. So having a period at least once every 3 months is really important, and this is something that I think needs to be highlighted.
Now, let me come to the studio to you, Olagoke Sarah. You are a person living with this PCOS. Share with us your journey. What was the thing that said that you first experienced and you became aware of it? Said, something is wrong, doesn't feel right to let me go check.
Okay, so it started from missed periods. Like, okay, it was irregular at first. Then there was nothing for for the 3 months. 4 months, then people say, oh, are you pregnant? And I'm like, no. Then we had to go for pregnancy tests, series of tests. Some would say positive, some would say negative. Then the voice started changing. Like, I used to be the sweet Sarah with a sweet voice. Oh, yeah. It started changing. Then hair growth on my chin, and I'm like, where is this coming from? My natural hair used to be longer than my shoulder. Then it started falling off. Then I started having a funny shape on my head.
Wait, traction? Your
Yes.
hair was thinning.
Was just going, and I was having, and I'm like, okay, what happened? Is it because I cut the hair a lot, or maybe I used a relaxer? So I was like, let me just change it, and then we can know what else to do. But then I was not really seeing it as a problem. I was thinking, oh, maybe because, yes, growing up, menstrual cramps was a big issue. So at first I was like, oh, thank God, I'm relieved. Never knew it was something that is doing more harms to the body. Then when I finally got married, it started after introduction. You know, the Yoruba thing, you do introduction, traditional. So after the court wedding, then we're like, okay, let's start trying. Then there was nothing. Then I'll go to the hospital. You're fine. After a series of tests, my husband was tested. You're fine. Then when I went for an holiday in South Africa. Then I was like, okay, because my husband lives in South Africa. So I was like, can I see maybe a gynecologist or someone that I can even ask what is going on, because I know this is not normal. Because I was becoming, so the voice was getting thicker. Then if I speak
When
and
you say,
people,
you mean your voice?
my voice,
It affected your voice?
yes,
Your voice used to be thinner than this?
thinner than this. Then we met with the doctor and we had series of tests. Then we also did, okay, it was like, he has to do, I think, was it HSG? Yes, we did that. Very painful procedure. So, and there was like nothing. It's not like the fallopian tube were blocked. We came back home. We went to meet another doctor in Bagada. Luckily, the man is also staying in my estate. He has an hospital there in Arepo. Then I met with the man, and the man was like, with this whole explanation, I don't want to assume it's hormonal imbalance, but let's just try it again. Then I was given a drug, I think, was it contraceptives? Yes, something like that. Then I was reacting very bad to it. I became so bloated. I used to be very slim. I was size 8. So from size 8, I went to 12, 14. Then I was now dancing between 14 and 12. Then the man said, okay, this is it. And I was like, what did you call it? He said PCOS. I said, no, I know PCOS in Ibadan. He said, it's PCOS. Then in that office, we sat down with his laptop. Then we now started the whole, should I say, education. Then I was like, okay.
In recounting, because we're pressed for time, in recounting your journey till your diagnosis, and women are listening, how would they navigate this similar situation, and what kind of advice would you give them now? You know, in just watching you and listening to you and seeing
As
all
an
the
advocate.
symptoms, how would you advise them to go about this to get an earlier diagnosis?
Okay, firstly, PCOS is not the end of the life. It's not a death sentence or something that cannot be managed. You can manage it. So if you detect it earlier, in case you miss your period, 1, 2, 3 months, please don't wait for the 4th month. Go to the hospital, meet them, explain to them, and if they say, oh, you need to take birth controls, tell them no. Because that was what we started with, and I reacted badly to it. They want to bring the period with birth controls. Tell them no, that you need proper treatment for this. Then you now need to watch your own lifestyle as well, because PCOS changed my lifestyle from a whole lot of things, even dieting. Then I had to focus on consuming more healthy nutrition. So it changes so many things. Then even sleep pattern, so sleeping pattern, you need to change it. And at the end of it, I'm now a mom. My baby is in the studio.
Congratulations. Let's come to doctor, because we're pressed for time. Doctor, solutions, as always, we have to prefer solutions. What is treatment? Is there treatment? Are there testing? I say this every time, that science has failed women when it comes to tests, especially black women. But what are the options for treatment and testing?
So usually testing involves blood tests, especially looking for your hormone levels, but also an ultrasound scan to look for signs of polycystic ovarian or polycystic ovaries on your ultrasound. Now, if there's a diagnosis made, as I mentioned before, there's 3 criteria, and only one of those criteria is actually having polycystic ovaries. So when a diagnosis is made out of if you have 2 of the 3 criteria, which include having the excess male hormone and having irregular periods, then we can then start thinking about the options. And I think we divide it into two categories, whether you want to have children and conceive, or whether you are not ready to conceive. And she's mentioned about hormonal treatment. Actually, for some women, that's actually life-changing, because the hormones can help regulate the periods. And if a woman hasn't had a period for 3 months naturally, her womb lining is at risk of getting thick, and that can lead to womb cancer. So if she's not bleeding naturally, then we might need to give hormones to induce the bleed. That doesn't mean being on long-term contraception. Now, that's an option for some women, and that's what's needed in some women, but it's all about personalized care. Other women need that progesterone hormone to induce the bleed. We can also use the hormone coil. Now, for women who want to conceive, if they're not ovulating naturally, there are supplements that can be taken, but there's also medication that can be given to induce ovulation. And for some women, IVF treatment may be necessary. But what the lovely lady in the studio was talking about in terms of dieting and lifestyle is crucial. Even small weight changes can improve PCOS symptoms. So even a 5% weight reduction. So what are you eating? So eating low amounts of carbohydrates, and eating healthier carbohydrates. So brown rice rather than white rice, brown bread rather than white bread, those sorts of things. Increasing your fruits and vegetables and lean proteins in your diet, but also physical activity, moving, and then looking after your mental health.
Apparently, this changes your entire lifestyle, whether you like it or not. It's gonna have to affect everything. Well, I want to say thank you very much, Dr. Itunu, and also Olagoke Sarah, Mrs. Olagoke Sarah, for joining us and for sharing your expertise and also your personal experience with both of us here today and, of course, the audience. PCOS is a condition that affects so many women, but it doesn't have to be a life sentence like we've learned here today. With the right information, support, and also treatment, women can manage their symptoms and live healthy and fulfilling lives.
Absolutely.